So far, so good today.
Doctors, nurses, the elderly with underlying health conditions, and the most vulnerable at nursing homes around the country. These would be among the first people to receive the COVID-19 vaccine that in clinical trials showed positive results. Dr. Anthony Fauci says the U.S. has 2 vaccines whose manufacturers claim are nearly 95% effective.
We now have to convince people by our transparency and our openness and showing the data to get vaccinated.
Infectious disease physicians are waiting for critically important information to be released by the pharma giant Pfizer. And just as critical, how the U.S. Food and Drug Administration is viewing the early test results.
Well, I think first quarter. I think by the end of March or April, we should have widespread vaccination in place.
The pandemic has been punishing the United States as cold weather settles in. As many as 3,000 people a day are dying, and infections are way up.
The pandemic in the world is not going to be controlled for multiple years. And so we'll always have a global risk of reintroduction for susceptibles if they haven't been vaccinated.
Doctors say if they had to use a word, it would be hopeful that the vaccines could be ready in the first quarter of 2021. Then comes another major question. How will the vaccines be divided between the wealthy nations and developing countries? Doctors say the United States has already pre-purchased millions of doses of COVID vaccines.
I think the rich nations will be able to purchase vaccine. Whether poor nations will be able to purchase it or not remains to be seen.
The sobering news remains. The United States has far more reported cases than anywhere else in the world. And for the foreseeable future, doctors are urging citizens here to wear masks, wash their hands frequently, and keep a reasonably safe distance from others.
God bless America.
But many in the U.S. continue to reject those pleas. And there is no vaccine to ensure common sense. Sean Caleb's, CGTN, Washington.